This product is a combination of vitamins and fluoride, and it is used by children to treat or prevent deficiency due to poor diet or low levels of fluoride in drinking water and other sources. Vitamins are important for the body and help keep you in good health, while fluoride is used to prevent dental cavities. It is important to follow the dosage instructions provided by your healthcare professional. It is typically recommended to take 1 tablet daily or as directed by your doctor. It is best to take this medication at the same time every day to help you remember. Be sure to chew the tablet thoroughly before swallowing. Make sure to chew this medication thoroughly before swallowing. It's best to take it once daily at bedtime after brushing your child's teeth, or as directed by the doctor. If your child has trouble chewing and swallowing the tablet, be sure to consult with a doctor or pharmacist for advice. Remember to take this medication at least 2 hours before or after consuming any products containing calcium or aluminum/magnesium hydroxide, as these may decrease its effectiveness. The fluoride in this chewable tablet can be absorbed directly into the teeth during and after chewing, as well as being absorbed into the body from the stomach. It's recommended not to eat, drink, or rinse the mouth for 30 minutes after taking this medication. Taking this medication regularly is important to get the most benefit from it. Try to take it at the same time each day to help you remember. Be sure not to take more than the prescribed dose. If you experience stomach upset, constipation, or nausea, it is important to talk to your doctor or pharmacist. If you notice any changes in the color of your teeth, be sure to notify your dentist or doctor, as this could be a result of too much fluoride. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. While many people do not experience serious side effects, it is important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or difficulty breathing. While this is not a complete list of potential side effects, it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before giving this chewable tablet to your child, make sure to inform your doctor or pharmacist if your child is allergic to any of its ingredients, or has any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to consult your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your child's medical history before giving them this medication. If your child is pregnant, it's important to let the doctor know before giving them this medication. It's also important to note that this product can pass into breast milk, so consult your doctor before giving it to a child who is breastfeeding. As for the uses of Pediatric Multivitamin No.175 with fluoride 1 megagram chewable tablet, it is used as a dietary supplement for children who may not be getting enough vitamins and minerals from their diet. It is also used to prevent or treat a lack of fluoride in the body. The daily dosage and the best time to take this medication should be determined by your child's doctor based on their specific needs. It's important to be aware of potential drug interactions when taking Pediatric Multivitamin No.175 with fluoride 1 megagram chewable tablet. This includes both prescription and non-prescription drugs, as well as herbal products. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare professional before making any changes to your medication routine. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency medical assistance right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. For residents in Canada, you can reach out to your provincial poison control center. Symptoms of an overdose may include nausea, vomiting, and stomach pain. Remember, it's important to not share this medication with others. It's also important to note that this product is not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods and maintain a well-balanced diet. If you're wondering about the fluoride content in your water supply, you can inquire with your local town or city officials. If the fluoride content is greater than 0.6 parts per million, then fluoride supplements may not be necessary. However, if the fluoride content in your water supply changes, it's best to consult with your doctor or dentist to determine if extra fluoride is still needed. If you forget to take a dose, take it as soon as you remember. If it's almost time for the next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. It's important to store Pediatric Multivitamin No.175 with fluoride 1 megagram chewable tablet at room temperature, away from heat and moisture. Remember not to store it in the bathroom and always keep it out of reach of children and pets. When it comes to getting rid of this product, you shouldn't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.